why errors affect our monthly reports, how to pull reports, and most importantly, how to find those errors. Then I'll do a live demo and go over some reports, and we'll talk about how to fix them. All right, so first off, we just want to start again with our inventory workflow. So we just want to make sure everyone understands how the process works as far as receiving orders, administering vaccines, submitting reports, and such. So the first step, again, is going to be ordering your vaccine. So doing that through the system, I'm sure everybody is already doing that. And of course, receiving those vaccines as soon as you physically get them into your office. And once you receive vaccines, we all know that all those doses then go into your reconciliation page, so you'll see all your doses available. The next step in the workflow is, again, administering vaccines, so giving them to our patients and charting them either in our electronic medical record or if we're manually entering right into the registry or the IIS. So after we administer, we want to make sure we're monitoring our inventory. So we're reviewing our reconciliation page, we're doing counts in our fridge, we're double checking, making sure that we're being very accurate and making sure the system knows what we have at any given time in our cold storage unit. The next step in our workflow is the troubleshooting. So we're going to focus on finding discrepancies, how to correct our inventory when we find any errors, and then most importantly, how to correct those in the patient records so that everything is accurate and up to date. And then the last step in our workflow is our state reports. We're not going to talk too much about the two monthly reports that you are going to submit, but if we have questions at the end, we can always try and get those answered, or we can talk offline about our state reports. So I believe Rhonda covered this, so we'll just quickly talk about some causes for errors before we get into the report. So the most typical error we see are typos. So let's say that you're in your electronic medical record and you administer a vaccine to a patient, and instead of all of your information auto-filling as far as lot number, manufacturer, expiration, all that kind of stuff, let's say we hand type it in. And when we hand type it in, if there's anything that's not identical to what the registry has as far as that lot number goes or that vaccine type, it's not going to communicate properly and it's not going to decrement. So we really got to focus on making sure we're typing in our lot numbers exactly how they look in the registry and picking the same manufacturer and all that information. So incorrect lot numbers, again, will lead the registry to not decrement out of your inventory. Good fridge management, everything goes back to that. So making sure, for example, let's say you have 4 boxes of DTaP. Let's always try and use the first box first, so we use up the entire lot number before we open up a second box of DTaP that has a different lot number. A lot of vaccinators will use the same lot number over and over and memorize that, and as soon as the box is done, they forget that they need to change the lot number. So really making sure that you only have one box open and all vaccinators know which lot number to be pulling. Making sure you're picking the correct vaccine is always very important. So that's a very common cause for an error as well. For any float staff users, making sure that you are always logged in to the correct facility is very important, because if you are, let's say, at a South clinic on a Monday and then on Tuesday you're at a North clinic and you're still logged into South, all those vaccines that you're administering at North, it's going to be pulling from the South supply. So really making sure that you know who is at your clinic that day, and making sure everyone's logged into the appropriate location. And then the last one here is making sure that you're choosing the vaccines from the correct supply. So making sure that kiddos under the age of 18 are getting publicly supplied vaccines, and you're not giving any adults over the age of 18 our public stock. So those are kind of a few causes for errors. All right, so today we're going to talk about our reconciliation page, and I'm going to just show you quickly where that print button is and how to do our count. We're going to talk about the patient detail report. That's a great report that I always encourage providers to start using when we start our troubleshooting. That report can really tell us where we're missing information. So like we talked about earlier, let's say that we forgot to choose our lot number or our manufacturer or anything that's going to directly tie and decrement with that vaccine. We can look for it on the patient detail report. We can look and make sure that historical vaccines that were documented in the registry or in your electronic medical record was really a historical vaccine. And if it wasn't and it was administered at your facility, we'll want to make sure to change that so that the appropriate vaccine will be decremented from your inventory. The second report we're going to talk about is called lot usage and recall. Some of you might be familiar with just the name lot recall, but we've added the word usage. So now it's called lot usage and recall report. This report's really handy because it gives you a list of all the patients that were given a certain lot number. So this report, you can narrow it down or you can make it broad. So that's kind of nice, and I'll show you those. Also, it's really good for finding if you've, marked incorrect, if a kiddo was given a public supplied vaccine and you chose private, so we can find that from the lot usage and recall report as well. This report's also good for making sure your staff are at the correct facility, and you can also use this to compare to any clinic records that you guys might be keeping in your EMR. And the last report we'll talk about today is called Vaccination Totals Report. This will show you every single vaccine that a particular vaccinator has given, and you can, run this for a certain number of days, weeks, or the whole month, however you want to see that information. It's really great, especially if you have lots of float staff in and out of your clinic. I definitely encourage you running this report if you see huge offerages in your numbers. All right, so before we start our live demo, are there any questions that we should get answered before we pull up the registry?
I don't see any questions in the chat box yet, but please feel free to type in any questions or take yourself off mute and ask questions as you need to.
All right, perfect. So I've already logged in. Before we start, I just want to make sure everyone knows that this is a test facility. So it's going to look a little bit different from what you guys are used to seeing, but I'm logged in to hopefully show the permissions that you guys have. So just so you know that. So first off, I just want to quickly show you underneath orders and transfers. This is where you create your orders, view your orders, and most importantly, you receive your orders here. So if you come in here and you see that you have approved orders that you physically received in your inventory, you want to make sure to select your order. You do make sure you've received everything. Everything looks great as far as the vials go. It's nothing dinged or dented. So again, that's the first step, is always make sure you receive your orders. So underneath lot numbers here is where we find our reconciliation page. And this page is a live view of what the registry thinks you have currently in your cold storage unit. So here, some clinics do count every Friday or every other day, and some people just do it at the end of the month. Whatever has been working for your clinic, stick to that. You can go in and reconcile your inventory as many times throughout the month as you would like by clicking the Save button. So the only time you click the Submit is when you're submitting those to Danette at the health district. So every month you are required to submit this report. But here it's really great, so you can print off this page, you can take it to your cold storage unit, you can do your counts, and you just handwrite here in your physical inventory. and it should match up to what you have here on your quantity on hand. So this is the first step to figuring out if you need to continue doing troubleshooting measures as far as your inventory goes. So this page is really important. It should be a live, up-to-date glimpse of what is in your refrigerators and your freezers. Some of the callers today probably have what's called, it's where a nightly batch comes over. So for example, let's say you gave 25 shots in your clinic on Monday. All your vaccinators were documenting the patient records in your electronic medical records system. So overnight, the interface will talk to the registry and send over all 25 of those vaccine records. So come Tuesday morning, all those kiddos that you documented in your electronic medical record, all their records will be now in the registry and you'll be able to view those. So it's important that we do our count and the submitting of our reports in the morning before any vaccinators have been in and out of your refrigerators, because all those nightly uploads have been sent over to the registry. All right, so now we're going to move into our patient detail report. So to find our reports, we want to go underneath reports here, and we'll click on report module. Here underneath the patient section, you'll see your patient detail, and you'll just want to click on that once. And it will open up a page that looks like this. So the very first step to running your patient detail is making sure you select by service. By service means they're going to be only those vaccines that were given at your clinic. So always check by service. So I encourage, if like, let's say that you are wanting to do a weekly kind of audit of what's going on in your clinic. So you can make this vaccination date range as narrow or as broad as you want. So if you were doing it every week, just do it for 7 days. If you're doing it for the whole month, run it for the whole month. For test purposes, I'm going to run it for many months just so that I can show you some information, because I'm not in and out of this every day. So I'm just going to do it from the beginning of this year and through today. And as far as my birth date goes, I'm going to do it from kiddos that are going to be 18 as of today. It will already have your facility auto-populated in there, so you won't have to worry about that. Again, this report is really nice because you can make it as narrow or broad as you want. So here you can select certain vaccines if you just want to see certain types of vaccines. But I'm just going to leave it for everything as far as this test site goes. And then the last thing you want to select, so here under publicly supplied vaccines, let's say that we're running this report just to find those errors when we chose, or when we documented giving a publicly supplied vaccine and we really gave them a private. So if you select no, it's going to only show those patients. So once we select no, then the last step is coming here and clicking Create Report. And here is where we're going to look for that missing pieces of information. So let's start by looking here at Alex. So it looks like he got a meninge vaccine, and it looks like here we're missing our manufacturer code and our lot number. So we keep looking across. It looks like it's not a historical. That's good. And it looks like we have an in under decremented. So that means no. So we can tell right off the bat that we're going to have one extra dose in our reconciliation page of our meninge than we have in our refrigerator. So what we want to make sure we do is go back and edit that patient record, either in your EMR. If your EMR has update messages being sent to the registry, we want to make sure to go to our EMR, go back to this exact vaccine record. We want to make sure that we pick our manufacturer code and our lot number. It will either automatically talk to the registry and update that child's record in the system, or it will do it overnight. So then after you have fixed it and updated it, you'll notice that the reconciliation page will now show that you have the correct number of your meninge that you really have in your refrigerator. So we'll look at this one too. So for example, this HPV, if you're looking across, it looks like it was not given a public lot. So you just want to keep looking over. It looks like they are VFC eligible. And you keep going across, it looks like it did decrement, but you just want to really make sure that they were not given the public lot number. And if they were, you're going to want to go into their patient record and update that. And here's another example of a missing manufacturer code and lot number. So you can see here it didn't decrement, so you'll want to just update that as well. So as far as the patient detail report goes, those are the main things you're going to want to look at. Again, you can run it for only certain vaccines. You can do it for as many as you want. Really, it's up to you and what you're searching for. All right, so the next report we're going to talk about is our lot usage. So back underneath report, we'll go to report module. And here underneath the vaccination section, you'll want to come down and click on our lot usage and recall report. So here it's going to look a little bit different than our patient detail. So here it's going to show you in this particular box all the active lots that you have currently. It will show you here all of your inactive lots and here all your expired lots. So if you wanted to only look at certain active lots, all you would do is select it, click this arrow, and it will move it over to the selected section. Here you can specify if you're only looking for certain date ranges or certain lot numbers. So I think for test purposes, I want to just run. We're going to do the same big date range, but for you guys, please do it if you're doing it just for the month of April. Just run it from the beginning of April through the end of April. Depends on how you want your information shown. So here, this report, again, it's really nice because it's going to show you all the patients that have received certain lot numbers. So your list will look a lot bigger than mine, but again, you're just really focusing on particular lots. If you're looking at your reconciliation page and you're noticing that you have huge numbers that are either off or you have negatives in there, you can pull this report to see every patient that received that vaccine lot number, and then you can make corrections if needed in their patient record in your electronic medical record or manually in the registry. All right, so we're running short on time, so I'm going to just now jump into our vaccination totals report. Okay, so that one, sorry, it's at the very top of your page underneath vaccination. And this report is handy because it's going to show you, you can display it however you'd like, but it's automatically going to have the box checked for total vaccinations by a certain vaccinator. So if you have a float staff that you're kind of iffy about, wondering if your numbers are off because he or she forgot to change their facility, this is a great report to run to see exactly how many doses that vaccinator has given. So you can, again, you can choose certain vaccines if you notice that one particular one is off. You can do vaccination date range, so I'm just going to do the big one again. And I'm just going to only leave this one checked because that's the only piece of information that I'm running this report to find. So the last step is just creating that report. And here it looks like our 2 vaccinators It shows you how many total vaccinations they've given, and for test purposes, it's small numbers. Yours will be a lot bigger, but this is a great report to pull if you have lots of float staff coming in and out of your clinic. So I am going to ask for questions at this point as far as the demo goes. If you have anything you need me to do over again, I'd be happy to do that. Otherwise, we can jump back into the PowerPoint and cover a few more things, and then we'll just sign off because it's getting really close to time. All right, I'm not seeing any questions, so I'm going to pull back up the PowerPoint. And this is just another screenshot of things you want to look for in your patient detail report. And actually, one thing we did not talk about was the lot number. So let's say the lot number came across, but it didn't decrement. So you want to make sure that some clinics have to manually type in their lot numbers. And if it's maybe off by one number or it's missing a number, you want to make sure that you go back into the patient record and update that so that it will send the update message, or manually you can enter the correct vaccine type in the registry for the lot number, and it will decrement. So that's a big one. You want to make sure that you're double checking your work and correctly typing in lot numbers if you manually have to do that. So there is a difference between, sometimes there are records that you need to delete instead of update. So this is a good thing to either jot down or have sticky notes somewhere. So whenever you're updating a patient record, you're allowed to do that for lot numbers and other vaccine details as far as the vaccinator, the route, the manufacturer, the site. Those types of things can all be updated in the patient record. And there's two things that are hard stops that the registry makes you delete and redo. And those two things are if the vaccination date is wrong and if the name of the vaccine is wrong. Then what the system makes you do is completely delete that record and redo it in your registry, or I'm sorry, in your electronic medical record. Or if you're manually entering, delete it out of the registry and re-administer that vaccine into that patient chart. So those are the two things that are hard stops that the system makes you delete. And just a couple of reminders, again, just making sure you're doing your counts first thing in the morning or as soon as the clinic closes so that you know no one's going to be in and out of your cold storage unit. Remembering that sometimes your messages will come over the next day. So if you log in before you leave work at night and you wanted to see that Jimmy was vaccine has come over to the registry and you don't see it, it might be because the nightly batch hasn't been sent yet, and in the morning, if you pull up his chart, it will be there. And then the last thing to notice is sometimes this happens a lot with twins, or if if some patients have really similar names and birthdays, those records will be placed in an area called manual dedupe. What that means is somebody at DOH has to physically look and compare the two records to make sure that really they are two separate patients. This is typically done on a daily basis, but sometimes it will take a few days for someone to physically look and make sure that those are two different records. So if you're wondering why so-and-so's information hasn't come across in the registry, it could be because it's in that manual dedupe area and it just hasn't been looked at yet. So that's going to be another reason why sometimes you don't see the patient's record immediately in the registry. And I think that concludes talking about the reports. I know it was kind of quick, so please feel free to ask questions. I'm going to stay on the line. I can demo anything again that you need me to show you. So yeah, Jeanette, I don't know if you want to unmute phone lines or how you want to go about that.
Yeah, thank you, JC. That was great.
You're welcome.
if there are any questions, I know we're out of time now, but if you have any questions after this presentation that come up for you or next time you're doing your report, please don't hesitate to contact me either by phone or email, and I will do my best to get back in touch with you as soon as possible. Also, I am out in the community quite a bit doing face-to-face trainings as well. So if you need some further assistance more than this, these Lunch and Learns offer, I'm happy to do that. But as always, we always want your feedback as far as what you need to see at these Lunch and Learn sessions so that these are useful for you moving forward. So let me see if we have any other questions. It looks like Glenn typed in a question about how do you know if your order's been shipped? Basically, what are the different statuses mean in your order? And so I responded, I'm not sure you can all see that, but there are a few different statuses you could see when you've placed an order. First, it's going to go into what we call local approval, and you'll see it listed that way. In local approval, that means it's here at Spokane Regional Health District being reviewed and approved. You could see that it says in state approval, and that means it's with DOH and Olympia being reviewed and approved. And then once McKesson gets it, the order and ships it out, they will indicate it's been shipped. So those are the various different statuses you'll see in that order and what they mean. Sometimes McKesson does put in a tracking number so that you can gauge when that order is going to be to you, but that's not 100% all the time, and sometimes the tracking number is actually put in after you've already received it. So it's not always foolproof, but that's another way you could gauge that as well. Are there any other questions about the troubleshooting and how to find or correct errors with your monthly reports? Okay, then I think we'll sign off, and thank you again so much for joining us today, and please let us know if you have any feedback for these Lunch and Learn sessions. Thanks, guys.
Thank you.